Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks, also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Diagnosis and Treatment, Primary, Secondary and Tertiary Exercises, Part 1. Primary Exercises, Cognitive. The cognitive exercise, as its name indicates, is intended to correct a cognitive distortion in the patient, the consequence of which is a behavioral pathology. Cognition, sensory and emotional perception of reality is fundamental when restructuring behavior. Under the prism of modern clinical intervention, it would be very difficult to restructure any behavior. It would be very difficult to restructure any behavior from the behavioral point of view alone. If cognition remains distorted in the patient, the likelihood that pathological behavior will be inhibited is minimal. Therefore, before addressing behavioral goals, priority is given to cognitive restructuring. Example. Now, I want you to look at yourself. Cognitive structuring of the behavior to be restructured. An approach is necessary whereby the patient understands and perceives adequately why he or she does certain things, what are the motives that drive him to do them, and the consequences of his actions. This exercise is based on recognizing, knowing, realizing that the patient must realize that what he or she does to his determined. This exercise is based on recognizing, knowing, realizing that the patient must realize that what he does is to his detriment. He must recognize the things he is doing, and he must even be told in a slightly rude way. I want you to visualize yourself as a fat girl, very fat, ugly, chubby, fatty, with puffy eyes, very puffy face, with rough handles, not stopping eating, binge eating. Everyone sees you fat. You are fat. You are very fat. This in a visualization. Although at first it might seem that all people perceive reality in the same way, nothing could be further from the truth. Each person has a completely different cognition of their environment and behavior. For this reason, it must be understood that cognitive distortion underlies every pathological behavior, which makes it essential to adequately structure this cognition before considering any behavior shaping. Behavioral. A behavioral exercise is understood to be an operant conditioning that implies a behavioral action that is reacted to once the hypnotic session is over. This order, apart from conditioning, can be associative. Presupposing that the patient possesses a pathological behavior that is to be molded, behavioral exercises are aimed precisely at this molding of behavior. This exercise is based on correcting. We correct the behavior. From now on, you will never do this again, so that this does not happen to you. From now on, you will control very much what you eat. You will never again go off your diet. You will chew your foods very slowly, and you will only eat just enough without overdoing it at any meal. You will never eat too much by chewing your foods very well and not overdoing what you eat. This will make you have a very good digestion, and you will never again have discomfort in your stomach or any parts of your digestive system. This will make you lose weight and feel much better. All this through visualizations. The model behavior should be clearly described and looped abundantly. In case there are several aspects of the behavior to be structured, they should be considered separately. Examples: from now on, every time, and from now on, every time also. It is very important to understand that behavioral commands cannot conflict with the patient's primary moral code, and not only because of a simple ethical or deontological question, but because the primary moral code is also controlled by the unconscious, so that such a command will not get a response. It is quite possible that if an attempt is made to introduce an order against the patient's moral code, the patient will enter a repetitive loop of contradiction and come out of the hypnotic trance. In any case, the order will have no effect. It will find no subsequent response in the behavior. We recommend reading Levinson versus Harris, 1978. In the state courts of Los Angeles, where the therapist was sued for an alleged case of taking immoral advantage of his patient, taking advantage of the alleged state of helplessness produced by the hypnotic state to force a sexual assault. The therapist was acquitted due to the declaration of technical specialists, state psychiatrists, who called the impossibility of sexual assaulting the patient against her moral code. The judgment ruled that the instance of sexual aggression is not considered proven, nor that it did not exist. In any case, it is proven that if it had existed, it would have had the patient's consent. Therefore, it cannot be considered an assault. The therapist kept his license. The judgment may be surprising from a deontological point of view, but it is very precise in terms of the technical considerations of the offense of which the therapist was accused. Self-esteem. These exercises are intended to raise the patient's self-esteem. They are exercises in which the patient visualizes his achievements, where the patient visualizes himself as he would like to be, visualizes his ideal I. Now, I want you to visualize yourself in front of a mirror in which you see your whole body. You know that you have been dieting for a long time. You look in the mirror and you see yourself in the mirror and you see your ideal self. You look in the mirror and you see yourself slim, 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 beautiful, beautiful, with an impressive figure. You like the body you have. You feel very proud of what you have achieved. You are slim as you wanted. The bags and puffiness in your eyes have disappeared. You are very beautiful, very attractive. Now you know that when men see you in the street, they look at you and compliment you. And you like that. You know that they look at you because you're attractive, beautiful, very beautiful. You have achieved what you wanted. Another example would be, now you can wear all the clothes you like. You can put them on and see that they fit you very well. You're very happy with your new figure. I want you to visualize now how you have a coffee break with your friends. Your friends comment on how thin you are. Your friends are commenting on how slim and beautiful you look. You can also watch as a man sitting at a nearby table looks at you. Notice that you look very attractive and very rejuvenated. I want you to visualize yourself like this. Good self-esteem is essential for psychological survival. Without it, life can be painful and unsatisfactory, as it leads to a vicious circle of negative mental attitudes. Stimulating self-esteem builds self-worth. Self-judgment increases strength to cope with conflicts and frustrations, to value one's own achievements, and to find satisfaction in one's own life. This protects both the patient and the people around him or her, in that it supports the correct personal development and balance with the demands of the environment. Therefore, a correct sense of self-esteem must be present in every therapeutic process, as self-esteem is a sensible and balanced affection for oneself. Self-esteem is the valuing feeling of our being, of our way of being, of who we are, of the set of bodily, mental, and spiritual traits that make up our personality. It is also learning to love and respect ourselves. It is something that is built or rebuilt from within. This also depends on the family, social and educational environment in which we are and the stimuli it provides us with. Or if you prefer, self-esteem is the set of thoughts and feelings we have about ourselves and the set of feelings and moods that reflect our internal and external image. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Diagnosis and Treatment, Primary, Secondary and Tertiary Exercises Part 2. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you are interested, do not miss our next videos. Thank you very much for your interest.